Hi, this is Dr. Craig Castanet again in Decatur, Georgia. Today I'm going to review with you some lumbar stenosis. This is a lumbar MRI scan, a T2 weighted image. I'll show you some sagittal slices, and then I'll show you some cross-sectional images to show you how narrow it is at this level. If you look down here to orient yourself, this is the top of the sacrum, it's S1. This is the L5-S1 disc, the L5 vertebra. You can see this disc here at the L4-5 disc is herniated quite largely. This dark tissue back here is the ligamentum flavum, which is enlarged or hypertrophied. At this particular level, it's pretty critical, the narrowing or stenosis here, because of the combination of the disc herniation here and the hypertrophy of the ligamentum flavum here, which has its origins on the laminae of the vertebra above and below. If you see it at this level, not nearly as stenotic. It's pretty wide here and patent. These little lines are the nerve roots coming down the canal. It's fine there as well, but right here, they are really very encroached upon by these tissues. It leaves a very narrow passage to get through here. The lower level below L5-S1 looks good also. So we just have this one critical level. The other levels look reasonably good. This gentleman was actually a person who had a stroke and came to me, incidentally had the stroke, and has some back pain. So he's got back pain, and I think he had some sciatica also. So anyway, that's this particular sagittal image. Let me go to a different slice now. We'll go to the next one. This is a little different slice, and you have to look at all the slices because look at the same level here, how open it looks in this particular slice. It doesn't really depict how critically narrow it is in this slice, and you see how broadly or widely patent it is here at L5-S1, and it looks a little narrower here at L3-4 than it did on the previous slice, but this is not critical. Surgeons that look at this stuff, yeah, they'll acknowledge, yeah, it's narrow through here, but it's not critically narrow, it's not surgically narrow. There's no contemplation of surgery in an MRI scan that looks like this or that. At these levels, they'll do fine with non-surgical treatment. Let me go to the next slice. Again, another sagittal image in here. Again, it's critically narrow at this area, but not as bad as the previous one. Interestingly, in this slice, it also looks like there's a little bit of spondylolisthesis of L4-5, which would, be an additional problem. It looks narrow here, but these are not down the midline, which is generally the widest path. So when it's narrow off the midline in a parasagittal plane, then it's not as likely to reveal or be valid in terms of establishing how critically narrow it might be. The first image I showed you was in the mid-sagittal plane. So it looks pretty narrow here. Again, this is a significant slip off of here, but this is the only slice in which we saw. Let me go back. See, it looks pretty lined up here. Sometimes an apparent slip is not, and sometimes an apparent non-slip is. So you have to look at several images, and keep in mind these MRIs are done lying down on a table, so a slip may not be as bad as if the person's standing upright. So if I was really concerned about this potential slip, I'd have to order some other imaging, X-rays with the person standing and weight load-bearing, and also with flexion, to see if I can maximize any potential slip. Now let me go to the cross-sectional image through the canal here so we can look. In the cross-sectional image, you want to have a lot of white space where the nerves are traversing. So let's take a look at some of those slices. Here's one that doesn't look too bad. It is narrow, but all this white area here and these little dots right here are the nerve roots. So it looks reasonably open there, which is not to say it's not stenotic, it's just that it's not critically stenotic. In all likelihood, an MRI looks like this is not going to result in a patient that's clinically severe and needing surgery. Let me go to the next slice. And here's where it's pretty clear, critically severe. You got enlargement of the black tissue here. That's the ligamentum flavum on the right side and the left side as well. You also have this broad disc herniation or bulge across here. And this gray area and a little bit of white area, this is the space available for the nerve roots. So it looks like there could be sciatica, and it looks like it's a little narrower on this left side than it is on the right side. And remember, I'm saying right and left here because this person is lying on their back, and that makes, with their feet at the near end, head at the far end, that makes this the right side of the person, and this their left side. I'll go to the final cross-sectional image. Look how white and broadly open this area here is at L5-S1. So this is very large. There's one nerve root, the S1 nerve root. There's another one on the left side. So, and you see the disc is not herniated at this level. Ligament doesn't look particularly enlarged here or here. We do see cross-sectional of the muscles here. There's a little bit of atrophy there. Let's go back for a minute. Look at the significant atrophy of the multifidus muscles here on the right side and the left side. You see this commonly in people with back problems, chronic back pain, and the associated subsequent disuse. So you see this disuse atrophy of the muscles. And again, see how small this central canal is. Anyway, I told this gentleman, I'll treat you. We'll see if I can help. This stenosis or narrowing tends to be slowly progressive. So over time, it may become, well, even now, it might be critical. This may be that I can't help him enough, and I refer him to a neurosurgeon to do a laminectomy here, remove some of the lamina, some of the hypertrophied bone joint, and some of this ligament here. Maybe they leave it at that, or maybe they remove some of the disc tissue in the canal. But in all likelihood, I can probably help him if he wants to do a little bit of treatment. He also might want to do pain management, although generally I think that trying to improve a problem anatomically is better than just doing injections for pain until the anatomical problem progresses to the point that the only thing you're offering them is surgery. I pull these people apart with spinal decompression, and that generally helps for a while until and if this progresses to the point where it's not sufficiently helpful. In any case, if I can help you with your back or neck problem, I'm Dr. Craig Castanet in Decatur, Georgia. My number is 404-558-4015. Thank you very much. Bye-bye. Oh, one last thing. If you'd like to learn more, you can go to my website, backstrong.net. Thanks very much. Bye-bye.